Hi, Dr. Caleb here. Perhaps one of the most common questions that I get is, help me to better understand how I can get rid of my tinnitus. And it really is a great question. But in order to get the best answer to this question, we have to take a step back. See, we have to first understand tinnitus. We have to start with, why do people have tinnitus? How did they live with it? What can be done about it? And of course, how do you say it? Is it tinnitus or tinnitus? I actually say it both ways. So first, let's start off with the obvious. What is tinnitus? The definition is actually pretty simple and very straightforward. Tinnitus is a phantom sound that is heard in either the ears or somewhere up in the head. But let's stop right there. Tinnitus is a phantom sound. Now, I love that definition for two reasons, and here's why. Because the use of the word phantom is intentionally analogous to phantom limb. And that in turn reminds me of my dad, who wore a size 9.5 glove. In both cases, you're sensing something that is not actually there. See, with phantom limb, it's typically described as the perception or sensation. Maybe it's a pain that comes from a missing extremity or limb. And in both phantom limb and phantom sounds, or tinnitus, these false perceptions happen when the signal to brain is disrupted or damaged. This is the case 90% of the time. So let's talk more about what causes that annoying ringing or buzzing or swishing sound. And I've heard every descriptor out there. These sounds that you're hearing are most certainly the results of damage to your auditory system. And it can even happen in people who believe that they have normal hearing. Oh, and if you actually take a look at the number, there are 50 million people in the United States that report having tinnitus. The number might sound familiar, as you've heard me talk in my other videos about how 50 million Americans also suffer with hearing loss. Can't possibly be a coincidence. So given that tinnitus is actually a result of hearing loss and damage to your hearing system, you would think that everybody with tinnitus has a significant hearing loss, but not necessarily. See, the problem is there are a lot of people with quote unquote normal hearing that are experiencing tinnitus. This can be the first symptom of hearing loss. And it is really the first symptom of what is yet to come. Even when somebody says they don't realize their hearing is being affected, that doesn't mean that the nerves from ear to brain are not damaged. And that can result from age or noise exposure or even from certain medications. So let's now focus on the medical treatment of tinnitus and how we need to approach this problem. Let's get something out of the way right now. There is no cure for tinnitus. But there are plenty of major health conditions like diabetes, hypertension, and cancer that don't have a cure. But they have very effective treatment programs, just like treating tinnitus. In fact, studies have shown that the changes and adaptations in the brain sometimes are quick, but sometimes can take over a year. My colleagues and I will tell you that we have had countless patients who say in the office on day one, "Wow, the ringing is gone," or "That sounds so much better, I can barely hear it." But there are also patients that it can take a year or longer to notice the ringing go away. I'm being upfront with you because you need to have the right expectations. And look, regardless of how long it takes, it is the most effective treatment. After all, the alternative is to do nothing, and that is not acceptable. Continuing to let ringing interrupt your sleep, your concentration, get in the way of your hearing and your quality of life, that's not acceptable. See, we all need to understand that the damage to your hearing system, it's permanent and progressive, which means it will only get worse if not treated. So if you don't address tinnitus, it can lead to all sorts of problems like stress, anxiety, hospitalization, increased risk of falls or even dementia, even premature death. Yikes. So let's not let that happen. Listen. When it comes to treating tinnitus, the goal is to provide the correct sound feedback that can drive the brain and give it exactly what it needs to make the ringing go away. With this stimulation, you encourage neuroplasticity to do its thing. And when dealing with hearing loss, there's a significant loss of neural connections from ear to brain. And through treatment, the goal is to target those remaining nerves so that you can maintain the quality of the system. Otherwise, the nerves that are left untreated, well, they're going to die too. The brain will need time to adapt to the new sound stimulation in order for you to really experience a reduction in tinnitus. They say when you know a patient with tinnitus, you know a patient with tinnitus. because each patient is unique. Therefore, each treatment plan is unique and customized. We will lay out your custom treatment plan that depends on your individual hearing loss and your tinnitus and your cognitive needs. And again, when done correctly by the right clinician, there is nearly an 80 to 90% effective treatment rate with this process. Remember, with targeted sound stimulation and accompanying cognitive behavioral techniques, we can help to drive down that ringing for all of our patients, therefore helping everyone to live their best life. Take back your life and turn down that ringing in your ears. Thank you and take care.